Great. Well, welcome everybody to this EPI-WIN webinar. I think most folks know me, but if you don't, my name is Sarah Hess and I work for the Health Emergencies Program in WHO headquarters. Today, the topic of our webinar is on international travel in the context of COVID-19. So we're looking at all the questions that have been floating around about vaccination, certification, and testing in the context of international travel. And I'm very pleased to welcome three colleagues on the webinar today to share their perspectives, insights, and expertise on the subject. Before I introduce my colleagues, I'll just like to reiterate the housekeeping. We have simultaneous interpretation to French for those who are joining through Zoom. So if you prefer to listen in French, please do find that in the bottom toolbar of the Zoom. We will, of course, be recording this. We are streaming it live onto YouTube. So after the event, you will be able to find the recording there. And the slides will be shared with everybody who has registered as well. So if you have any questions during the event for our speakers, please feel free to put them into the Q&A, not the chat, because we can easily miss them in the chat. But if you put them into the Q&A, then we will try to have time towards the end of the webinar to answer some of those questions. So without further ado, I will introduce my colleagues. We have Dr. Roberta Andrighetti. Roberta sits in our office in the Pan American Health Organization, so in Washington, I believe, but maybe you're in lockdown and sitting somewhere else, but somewhere in the US. And Roberta is an advisor on the international health regulations. We also have with us Philippe Feltsos, who is a technical officer in the Public Digital Health Technology Unit within the Science Division here at WHO headquarters. And we have Sarah Barragan Montes, who is a technical officer looking at border health risk within the Border Health Risk Dissemination Unit in the Country Readiness and Strengthening Department, also within the Health Emergencies Program here at WHO. So welcome to all three of my colleagues. And I think we will just go straight into the presentation. So I will share my screen, and I believe I'm handing over to Roberta first. Over to you, Roberta.
Yeah. Thank you, Sarah. Good morning, good afternoon, good evening to everybody. And I'll be tackling the first set of slides and then leave it to my colleagues. Next slide, please. Okay. Now, just to give the context of the epidemiological situation, as of mid-March, we have registered almost 120 million COVID cases worldwide, with over 2.6 million deaths. Over the past week, in these slides, you have the distribution of cases and deaths over time by week, and the number of cases is represented by the 6 WHO regions in different colors. Over the past week, we have observed an increase by 10% of the cases reported worldwide, corresponding to 3 million cases reported, and this signals the first increase after early January. In terms of death, we have observed a decrease in the number of deaths reported worldwide, and this decrease is equivalent to the level observed in mid-November. With respect to the most affected region, Europe and the Americas continue to account for the vast majority of cases reported worldwide, about 80% of the cases reported. And we have the countries that are accounting for most cases at present are Brazil, where the situation is unraveling, and the US. This is you can find this data published on the WHO dashboard and with an analysis published on the weekly update. Next slide, please. Now, with regard to travel measures that countries have put in place since the beginning of the pandemic, the measures, they have been subject to very rapid changes, and the measures adopted represent various combinations and permutations of what are believed to be mitigation strategies. Now, the adoption of travel measures in response to the spread of COVID is driven by the introduction, the availability of the COVID-19 vaccine. Up until now, there are about 400 million doses that have been distributed, stroke administered worldwide, and the vaccine has been administered to individuals in over 140 countries so far. Depending on the availability of the vaccine, we have obviously vaccination coverages which span across a wide range for under 1 percentage point to over 70% of the country population in some cases. Up until now, WHO has included in the emergency use list for vaccine, the Pfizer vaccine, the AstraZeneca vaccines produced by the Serum Institute of India and in South Korea, and the Johnson & Johnson vaccine. And this is the context. This is, I think, is the reason why we are having this webinar, because of the introduction of the vaccine, the availability limited of the vaccine. In terms of measures in place, as I mentioned, there are a wide range of combinations and permutation. As an organization, we have been trying to keep track of measures adopted by the countries, and as of mid-March, we have 4 countries that requires a vaccination certificate as an exemption to exempt travelers from quarantine requirements. We have 6 countries that have considered the presentation of a vaccination certificate against COVID as an exemption of testing requirement, and we have 25 countries roughly, but could be more, which requires a combination of testing prior and or after arrival, prior to departure and after arrival. And there are 63 countries which requires quarantine upon arrival for international travelers. Next, please. The way WHO is issuing recommendations in relation to international travels, to measures related to international travels, is related to the fact that the COVID-19 pandemic was determined to be a public health emergency of international concern according to the provisions of the International Health Regulations, the IHR. And in that context, an emergency committee is convened roughly on every 3 months, and on the committee submit his advice in terms of measures to control the pandemic to the Director General of WHO, and the Director General of WHO subsequently decide to embrace that advice and to issue temporary recommendations for state parties. The Emergency Committee is also providing advice to the WHO Secretariat in terms of actions to be taken. And during the last meeting of the IHR Emergency Committee regarding the COVID-19 pandemic, the committee advised the WHO Secretariat to develop a position paper regarding the proof of vaccination against COVID-19 for international travelers, and also to start looking into a digital solution should the proof of vaccination against COVID-19 become a requirement for an option, a requirement for international travelers. Next slide, please. Now, regarding the temporary recommendations that the Director General has issued on the basis of the advice of the IHR Emergency Committee, the temporary recommendations at present, which are current as we speak, are the following. Countries are recommended not to introduce requirements of a proof of vaccination or immunity against COVID-19 as a condition for international travelers to entering or exiting any given country. And in the case countries regards the proof of vaccination as a condition to waive quarantine or testing requirements, the fact that the proof of vaccination exists should not exempt international travelers from complying with other mitigation measures for the control of COVID-19. And of course, as I mentioned earlier, roughly these recommendations are revised every 3 months, but could be an emergency committee could be convened at any point in time should there be any major development. Next slide, please. Now, following the advice of the IHR Emergency Committee asking to WHO to develop a position paper on the use of a vaccination certificate against COVID for international travelers, this was done by the WHO Secretariat, and the position paper was published at the beginning of February. And the position of WHO revolves around 4 sets of considerations: scientific, ethical, legal, and IT considerations. And of course, WHO in shaping its position regarding the, at present, non-introduction of the certificate, the proof of vaccination against COVID-19, the Secretariat is taking into account also the recommendation of the Strategic Advisory Group of Experts on Immunization, SAGE, which is revising developing, advising or recommendations related to the use of the COVID-19 vaccine, which are progressively becoming authorized by WHO as the documentations are being revised by the pre-qualification group. Next, please. Now, at present, the position of WHO regarding the vaccination, the proof of vaccination of against COVID-19 for international travelers is fully aligned with the temporary recommendations. WHO does not recommend introducing the proof of vaccination against COVID-19 as a requirement for entering or exiting a country. And the scientific reasons underpinning this position primarily revolve about the efficacy of the vaccine, because at present we do not have sufficient information to formulate, to appraise whether or not the vaccines being used have an impact on the transmission of SARS-CoV-2 virus, and hence on the translocation of SARS-CoV-2 virus through international travel. There are also another number of questions of scientific nature which are underpinning the current position, which are related to the duration of the protection confirmed by the vaccines that have been authorized and future vaccines that will be, to the number of doses that will need to be administered, and also to the timing of vaccination before travel in case the vaccine has an impact on transmission. And then we have this kind of question marks that would need to be addressed before revisiting the position. Next slide, please. Regarding the ethical considerations which are underpinning the current position of WHO, not to introduce the requirements for proof of vaccination against COVID-19 for international travel, the revolve around the availability of the vaccine. COVID-19 vaccines are currently not universally available, nor they are accessible. And therefore, requiring a proof of vaccination as against COVID-19 for international travelers would introduce inequities depending on the likely related to privileging travelers from high-income countries. And most importantly, also echoing the position of the SAGE, at present, the preferential vaccination of travelers for being travelers, considering international travelers as a priority, would potentially deprive other at-risk subgroup of population from benefiting from the vaccine, which has an impact on the severity and the mortality, in decreasing the mortality related to COVID-19 infections. Next slide, please. Now, once the scientific unknowns or unanswered questions will become answered, or the scientific evidence will become clearer, and once the availability and accessibility to the vaccine will become more widespread, should WHO, the position of WHO would be, back please, back, okay, the position of WHO will be revisited, as I mentioned, and should the position shift towards the introduction, the recommendation of introducing requirements for proof of vaccination against COVID-19 as a condition for travelers, for international travel, for entering entering or exiting for international travelers, then this recommendation would be formalized, or the mechanisms for introducing such requirements would be formalized according to the provisions of the international health regulations, which are the only global governance tool which we have available for governing this kind of matters. And WHO would be taking into account whether the vaccines that have been authorized, including the emergency use list, the proof of vaccination would have to be recorded according to the International Certificate of Vaccinations or Prophylaxis as per Annex 6 of the regulations, and the legal requirement would be introduced through different legal mechanisms which are not mutually exclusive, and which would be starting from the issuance of temporary recommendations in relation to a public health emergency of international concern. Then there could be the allowing for the requirements of the certificate of vaccination at COVID-19 could be extended and be made more long-term by through the issuance of standing recommendations. And also there will be the need to issue or stroke amend Annex 7 of the International Health Regulation, which at present only concern the yellow fever vaccine, which is the only proof of vaccination which countries could require if they wish so, in order to allow for international travelers. And now I think we move to the technological IT considerations that Philippe will be addressing. Thank you. Over.
Thank you, Roberta. And yes, I'd like to hand now to Philippe.
Thank you, Roberta. Thank you very much, Sarah. So as my colleague Roberta mentioned earlier, there was 4 pillars to the considerations. And the last one, the not least, are the technological consideration around such a proof of vaccination for international travel. These were actually informed by key design principles, which we wanted to make sure that from the technological consideration were being implemented and considered for the wider group. The first one around being equitable, so that everyone has the right to obtain and hold a vaccine certificate, and it should not be increasing health inequities or increasing the digital divide. The second principle being accessible, being able to work online or offline in different environments across multiple platforms, leveraging what we hope are open standards and possible open source solutions. The third principle will be scalable. And again, scalable meaning that it supports both local and sustainable development, so that member states have a fair choice of solution and that they scale to their context. Not all countries have the same size of citizens, not all of them have the same capacity or digital maturity. So again, we want to make sure that these are scalable within their own context. There is also the flexibility aspect, where the software should be neutral, open standards based, again, if possible, and to choose the appropriate component for the solution, understanding that a lot of them already have solutions in place for standard electronic immunization registries, immunization information system, or even electronic health records. In terms of sustainability, we also want to make sure that this is something that can be leveraged beyond COVID-19. As the colleague Roberta mentioned earlier, today, under the International Certificate of Vaccination or Prophylaxis, yellow fever is the one and only disease or targeted disease that is considered for international travel. But again, should we actually be looking at technological solution, this is something that we want to make sure it could go beyond, just one disease, so that it can be leveraged and not just a one-off. The last one being privacy protecting and also following the data minimization principle. so that only the data that is required for the use case are collected and presented. We want to preserve privacy of information and protecting individuals from unnecessary exposure of their data based on the context in which they may actually have to provide such a proof. In addition, while the solution could and would include digital formats, it should also support paper to remain accessible to all 194 member states that comprise the organization, regardless of their current level of digital health maturity. Next slide, please. So again, as per the advice from the emergency committee that was mentioned earlier by Roberta, one of them was to coordinate with relevant stakeholders the development of standards for digital documentation of COVID-19 travel-related risk reduction measures, including vaccination status in preparation for widespread vaccine access. And in that regard, WHO put out a call for experts to establish a working group for the Smart Vaccination Certificate Initiative in late 2020, so November and December 2020. The aim of the working group is to achieve implementable specification and standards for any application of digital vaccination certificate for national or cross-border purposes to ensure consistent data representation, exchange, privacy, and security, ensuring also the governance and the collective trust across all types of users, and also to support the member states in their adoption of solutions that use this standard to facilitate continuity of care, program planning, verifiable proof, and patient empowerment related to COVID-19 vaccination delivery. So the working group that was created in January is a multidisciplinary group comprised of experts from the public, private, and academia sectors. We have about 183 participants today, including about 25 member states being represented. And we have members from 16 different international organizations working together to actually come up with some recommendation for potential digital solutions and the development of a standard for the digital documentation of COVID-19 travel-related risk reduction measures. The working group has already held several meetings since January, and we are happy to announce that we'll be publishing a release candidate 1 for public comment of the Smart Vaccination Certificate tomorrow. So it should be available on our website tomorrow. So if you're interested in the details of the specification, we do invite you to read the document and to provide your feedback. In addition to the specification, the working group is also exploring a governance framework and the architectures required at national and international levels to issue vaccination certificates, but also to validate and verify their authenticity and veracity at both national and international levels, online and offline. The working group is also collaborating with several other initiatives to inform the standards and details of the specification, including the core data set, the code system that will be used to represent those core data set elements, the data model for the vaccination certificate, should it become a requirement for international travelers. As mentioned by Roberta earlier, for now, vaccination certificates are not a requirement for international travelers, and countries are advised to do their own risk assessments. So with that, I will turn it over to my colleague, Sarah, to talk about some of the other measures. Over.
Thank you very much, Philippe. Sarah, over to you.
Thank you, Sarah. So in the next two slides, we're going to shift the focus slightly from vaccination to another measure that is very often implemented by countries as well, which is testing. First of all, let me clarify that the fact of crossing an international border, which is what defines a person as an international traveler, does not make a person a suspected case of COVID-19 per se, unless the person meets the criteria to be considered as such. Meaning, for example, that she or he shows signs and symptoms that are compatible with COVID-19 and lives or has traveled to an area with community transmission, or is identified as a contact of a COVID-19 case. And in fact, travelers in general are a population that is expected to have a lower prevalence of COVID-19 disease than the general population. And this is because we are recommending people that are sick with signs and symptoms that are compatible with COVID-19, or those who are suspected or confirmed cases to not travel. So for this reason, WHO does not recommend healthy travelers to be considered a priority group for testing. Now, this recommendation is particularly important in countries where there are very limited resources for testing. And in this context of limited availability, the testing resources that are available should be used in a strategic manner. What does this mean? It means that testing should be used for high-risk groups and high-risk settings, such as people who are at risk of developing severe disease, vulnerable populations, or health workers, where the use of testing will have a higher public health impact, and it will also help us to continue driving our public health actions in a successful manner. Now, what happens with countries that have enough testing capacities to cover all of these priority needs? And in addition to that, they want to be using testing as a measure to mitigate or reduce the risk of a traveler from importing or exporting even COVID-19 from the country. It is in these situations where WHO is recommending that national authorities use a risk-based approach to the use of testing, meaning that they conduct systematic and regular risk assessments in order to ensure that these testing resources are used in a manner that is efficient and effective and it's evidence-based. Now, how should these risk assessments be conducted? You may see on the slide on the right, there is a set of criteria that we have outlined there, and further information is in the guidance on the links that you can see on the slide below as well. There are some criteria that always have to be taken into account. The first of them being the local epidemiological situation in both the country of departure and also of destination. Also the state of the health system, meaning what is the capacity to absorb any potential cases of COVID-19 that may be coming from the traveling population? What is also the volume of travel? And of course, making sure that there are standard operating procedures at the point of entry to follow up with any incoming traveler who could test positive if testing is done upon arrival, or who presents symptoms and signs that are compatible with COVID-19 disease and may need medical follow-up. Another criteria that needs to be taken into account are other public health and social measures that are implemented both in the country of departure and that of destination to control the outbreak. And then finally, also contextual factors, such as the economic impact that implementing these measures may have, and also the extent to which the measures are feasible for the population to implement them. Next slide, please. Great. So if the authorities in a country implement testing as a measure to mitigate or reduce that risk of importation or exportation, as we have said before, and they do so based on the risk assessment that I very briefly just explained, there are also a set of key messages that are very important for all of us when traveling to remember. The first one is that testing cannot replace in any way other public health and social measures that are recommended to control the epidemic. These include, for example, the appropriate use of masks, good hand hygiene, including importantly, before we put on our mask, or and both before and after we take our mask off, respecting the physical distancing that is recommended throughout the whole of the travel journey as much as it is possible, and following a good respiratory etiquette. So even if we receive a negative testing result, it is important that we continue doing it all. Why is this important? The main reason is that getting a negative testing result at any given time does not guarantee that we are free from getting the infection after we have been tested. And it does not exclude either the possibility that we may have been infected very recently and we may have been tested during our incubation period. So this is why we keep saying that a negative testing result, when it is used in the context of international travel, may sometimes provide a false sense of security. So if you are required to present a negative test result and you get a negative test result before you travel, you have to continue applying to all of these measures during the travel journey, as well as at the place of destination, in order to make sure and to mitigate the risk of you being infected and also from infecting friends and loved ones when we travel to see them. Now, the last point is related to the recent developments, great developments that we have seen in the scientific community regarding the availability of rapid diagnostic tests that are also cheaper and that many countries are using in the context of international travel. Now, because we have said that travelers are a population that is expected to have a lower prevalence of disease compared to the general population, as we said before, we are expecting that rapid diagnostic tests, when they're used for the traveling population, they will result in a relatively high proportion of false positive results. This is with rapid diagnostic tests. Now, what we are recommending to countries is that if they want to use this test in the context of international travel for international travelers, they also have RT-PCR tests available as a second confirmatory step for those people who have obtained positive results from the rapid diagnostic tests. So let me just finish by saying that all of these recommendations that I have mentioned, and in a much greater level of detail, are available in the package of guidance documents on how to implement this risk-based approach to international travel that WHO published last year, and that you may find, whose links you may find on the slides. And we, of course, continue working with the scientific community, and in particular with our WHO guideline development group on international travel and health, to continuously reviewing the evidence that keeps coming out daily and update our recommendations as necessary. Over to you, Sarah.
Thank you very much, Sarah, Roberta, and Philippe. A really interesting and comprehensive overview. We're going to move on to a few of the Q&As, but in the meantime, Philippe, we've had a very specific request for you. You mentioned the publication of the specifications document. Is there a way you can be a bit more specific about where we might find that on the WHO site? So either could you share something in the chat or just speak quickly to that? Sometimes the WHO website's a bit difficult to navigate.
So, thank you very much for that question. The website, we're waiting for the final URL, but if you do a search for the Smart Vaccination Certificate, you should be able to find the page. We're hoping that it will be published tomorrow morning. This is the date of the launch. So unfortunately, we don't have yet the URL. I cannot point you to it today since the launch will be tomorrow. But for the colleagues trying to find it, simply log into the just access the WHO.int website and just search for Smart Vaccination Certificate, and you'll be able to find the latest page, which would be a call for comments to the Smart Vaccination Certificate specification. So hopefully you'll be able to find it. If not, maybe we'll be able to post it with this video or somewhere in one of our different media channels that we can use. Over.
Thanks, Philippe. And just because we have you speaking on the subject, there was a point for clarification. Will the specifications that will be published tomorrow set the global technical standard for vaccine passports to ensure interoperability?
Thank you very much for that question. So it's maybe a twofold answer. The first one, yes, we're hoping to have a standards-based approach as a specification for how vaccination certificates should be issued. And I do want to emphasize the term certificate. We are not issuing passports simply because passports are identity documents. They're usually not health documents per se. And the vaccination certificate, just like the paper-based home-based record or the yellow fever book, what we call the yellow book, or what my colleague Roberta was calling the International Certificate for Vaccination and Prophylaxis. This is what people actually carry with them as proof of their vaccination. So again, this is a health certificate document. It is not meant to be a passport. And from the perspective of being able to just have the historical information of your vaccination events stored in one place, a lot of the countries today are issuing paper-based vaccination cards. These will have to continue to be used. And the approach from a digital perspective for the Smart Vaccination Certificate is to have a standard so that every vaccination certificate will be based on the same standard, contain the same core data elements, and use the same representation, including the coding system. We'll probably not have one solution. As you know, many countries have already developed their solution. I believe the European Commission yesterday unveiled their digital green certificate. And there will be many implementations, but if we can all follow at least the same standard, that would be a step forward to make sure that all of these are indeed interoperable. Over.
Thanks very much, Philippe. And actually, another comment and question in the chat was about just that. How are we, with so many countries doing different things, how are we ensuring that alignment. So I guess the standard is the first step.
No, it's a very good point. Unfortunately, a lot of the technology is moving faster than we're able to get the science nor the policies and all of the other context that is required for this. The one thing that we'll be issuing, as we said, is a specification on the standard. So while these solutions have already been released, we will, ask and respectfully demand, if you like, that the solutions try to look at standards, simply because the way the internet works today is based on standards. So there are many standard setting bodies, and as opposed to just coming up with a solution, which will be an application, we believe that the right approach to have interoperability for these certificates, especially the digital ones, will be through the standardization.
Thanks very much, Philippe. Roberta, similarly to the question about where to find it on the WHO website, we've had a lot of questions asking about the IHR travel measure dashboard. Is this available to the public? And if so, where can we find it?
Thank you. No, the travel measures dashboard, from what I gather, is not yet available to the public, but I think that my colleague, Sarah, who is sitting in Geneva, might have more information on about where we stand with the travel measure dashboard. What I can say is that in different regional offices, in the regional offices dashboard, there are tabs addressing both public health and social distancing measures and travel measures. And what is being published by the some of the WHO regional offices is based on some are based on a certain data set, some others are based on a more in-depth and granular search and granular data. But I would like to leave the floor to Sarah. Over.
Yeah, thank you, Roberta. Happy to add on that. Indeed, so this data is being collected by our WHO regional offices. It's a very difficult task because, as everyone can see, all of the measures are changing very, very quickly in every country. The dashboard that was presented in the slides currently is a global dashboard. It's an internal one, and these measures are shared via what we call an event information system, which is an internal communication platform for national focal points in countries, national focal points of the international health regulations. Now, indeed, as Roberta mentioned, some of our regional colleagues have developed public dashboards to communicate what are the measures that are being implemented in these countries, not just in relation to international travel, but looking more broadly to all of these public health and social measures, and also to see how they relate to the different epidemiological trends that we are seeing in each country. So I know, for example, the WHO, the regional office for Europe, has been publishing a dashboard that has been very well received by countries and by the public. And I'm very happy to just search for it now, and I can provide the link on the comment section here.
Great, thank you, Sarah. I think that will be much appreciated by the listeners. There was a question about, do we have any information about how essential travel, such as diplomatic or vital logistics travel, is being regulated as of now?
Okay, regarding essential travels, first, historically, since the beginning of the pandemic, as an organization, we have been struggling about whether or not to define what essential travel is. And in every single document that we have published, we have been putting, expressing ourselves in terms of, for instance, for example, essential goods, supplies for the response in that sense. Then more specifically, as an organization, together with the International Maritime Organization, the International Labour Organization, and the International Civil Aviation Organization, we have made a bit clearer that crews and aircraft crews and maritime crews, yes, they should be treated as essential workers and recognized as such by national legislations. Overall, what we could be broadly regarded as essential traffic has not been dramatically, has not been effect has been recognized and respected, but yes, there has been a substantial impact on what we would regard as international, as essential traffic, for a number of reasons. First, because some countries have introduced embargo to certain goods for the exportation of certain supplies essential for the response. These are has not been the overall. These have not been a widespread and recurrent observation, but yes, this has happened. But overall, I can speak with knowing the situation in the Americas very well. In all the pieces of legislation and normative work that have been issued by countries, is specified very explicitly that essential travel is or essential traffic of this nature, X, Y, and Z, is allowed for national security, for the survival of the country. But yes, there is more work. This is one of the big lessons to be learned from this pandemic, how to define and to approach essential traffic in a coherent manner across the board, starting from the international level, in the hope that, again, standard would help in harmonizing. Over.
Thank you very much, Roberta. A question, Sarah, for you. You mentioned that the healthy traveling population generally have a lower prevalence of COVID-19. How can we be sure of that? Do we know enough about the asymptomatic disease to be sure?
Thank you very much, Sarah. So indeed, this is one of the main challenges when governing international travel in the context of this COVID-19 pandemic. And this is one of the reasons why WHO has published this risk-based guidance that is not just recommending one measure to be implemented, but is recommending multiple layers of measures that could reduce the risk from any individual, be that person a asymptomatic case or not, to reduce the likelihood of the person from infecting others, be that during travel or after travel or even before travel. So as I mentioned before, we cannot just trust on measures such as testing. We just need to continue doing it all. And in this regard, in order to prevent that transmission from passing it to others, it is important that we continue emphasizing the relevance of individual protective measures. As I said, appropriate use of masks, good respiratory etiquette, the respect of the physical distancing. This continues to be the most powerful measures that we have at our disposal, whether we are traveling or not.
Thank you very much, Sarah. So Michael had a comment to say that the adoption of a digital vaccination booklet makes sense, but the concerns would arise regarding it only working if countries adopt it and recognize it, and if the timeline is not too extended. So do we have any feedback from what national governments have been saying with regards to this digital vaccine book? Is it something that you think there would be a strong uptake on? Philippe?
So I can start, and I'll ask Sarah and Roberta to chime in. I think many countries have already started. I mean, we've seen those different initiatives, they're there, and the technology is moving much faster. But today, there's a lot of ethical concerns, there's a lot of equity concerns, there's a lot of access concerns around these solutions. Some of the colleagues were in the chat were also asking about the privacy and the security, and all of these concerns have to be taken into consideration. So today, from the health document perspective, the digital equivalent to what we have as the yellow book or what we call the ICDP would make sense. But again, from the data protection, from the security, from the fraud protection aspect, we want it to become digital so that we can actually make sure that this is issued by the right authority, that the content has been validated and signed, so that we know that it comes from a trusted source. But at the same time, those countries have already moved forward. They've already started. WHO is not in a position to tell its member states what to do. We can provide them with recommendations. And for their own context, they each have to take this risk-based approach that Sarah and Roberta were mentioning to say what's best for them. And unfortunately, a lot of these solutions are confusing and conflating identification with health documents, with many other aspects. And we can only encourage member states to consider the public health aspects for both the continuity of care and the proof of vaccination. But really, this is a public health pandemic, and we're looking at trying to find a solution from that perspective. So I'll ask maybe Sarah and Roberta to see if they have anything to add to that. Over.
Sarah, Roberta, anything to add?
Nothing else to add from my side. Thank you.
Okay.
No, I think just one observation is really that the IT is running faster than, as Philippe is mentioning, is running faster than science, that legislative work that needs to be done, and possibly we will be in a situation where all this work wouldn't be even warranted because of the characteristic of the impact of the vaccine on transmission. And we are in a bit of a impasse. My sense is that there is a huge hope to get out of this pandemic, and anything that sounds as a silver bullet is sort of embraced. But unfortunately, we are seeing more and more that there are no silver bullets, and then is balancing expectation, science, norms, IT is this multifaceted context that is difficult to navigate. I'm not helping, but I think this might.
No, I think you are helping.
Over.
I think you are helping. I think it's just very clear that it's a very complicated thing to navigate. We're almost at time, but I think we have time for just a couple more questions. So another one for Philippe. What are the roles of private sector? Applications or software for smart vaccination cards may be developed by the private sector. How will these types of initiatives be regulated?
Another very good question. So I don't think there is an aim to regulate these initiatives. As we mentioned earlier, the idea is to publish the standard as soon as possible. This is why we're even publishing a draft for comment of a release candidate 1. So it's really still a draft version, but we want to get as many people aware of what we're doing. And for all of the software developers and application builders, take into consideration the core data set, take into consideration those standards as you build those applications, so that tomorrow we can hope to have standard certificates being issued and available across these applications, so that at the point of crossing, or if such a vaccination certificate would be required in the future, that they would all be conform to the standard. And this is the key part, is really for any software developer out there, just look at the standard. We are trying to get the working group to inform these standards to be used, being in mind, keeping in mind that the experts are not representatives of different agencies or companies, but they're really experts in the different fields, including cryptography, including application development, including telecommunication, including different aspects of all of this, which have to drive the technology. And as Roberta mentioned, this is not considering all of the context of the technology, which is the ethical, the legal, the science, that have to inform whether or not this is the right way to do things. Understanding that we have colleagues from immunization, colleagues from the vaccine, colleagues from the epidemiological department. We have about 16 different departments present in this working group as well. So we're trying to get the expertise from everyone. And the plea to the application developers would be, don't go off to create your own standard. Try to see what the standards are in the specification. And if you have feedback, please provide it to us so that if there is something better, if there is a better way, or even something that's more robust, please let us know. This is the process to inform us is through that comment on the draft specifications.
Wonderful, thank you, Philippe. And perhaps as a last question, there's been a number of people commenting on IATA's Travel Pass app. Does WHO have a position on this?
Sarah, do you want me to take it or do you want to take it?
Happy to give it a first go, Philip, thank you. Just to say, we work very, very, very closely. We are in constant communication with our partners. This includes a lot of organizations inside of the UN system that Roberta has mentioned before, the International Civil Aviation Organization, the International Maritime Organization, the International Labour Organization, IOM, the Organization for Migration. I have seen that we have some of the colleagues listening to us today. This field is not just related to health, right? So it is our mandate, it is our obligation, it is our pleasure to work very, very closely with all of these organizations. Outside of the UN system, and when it comes to the aviation sector, IATA is one of the main partners of WHO. We are in constant collaboration with them. They are part of this consortium that Philip and his team is leading. And indeed, there are discussions happening so that we can make sure that we align as much as possible all these different initiatives. And maybe, Philip, you want to provide a bit more of further details on the technological aspects of how we're doing this.
Oh, I think, Sarah, you just mentioned it. We're working very hard to try to align all of these initiatives. And I know that we're at time, but just like Sarah mentioned, we're trying to make sure, since this is something across UN and across a lot of international agencies and impacting everyone, we're doing our best to try to coordinate and align our efforts.
Great, thank you. And so I think we are at time. I just want to say a huge thank you to our three presenters today, not only for the presentation and the briefing, but also for being in the hot seat and answering all the questions. I can see from all the comments in the chat that it's been hugely appreciated. And I'm sure that we would have to perhaps schedule an update one in a couple of months' time. There has been a lot of interest in this. And so any parting comments from my panelists here?
Yes, thanks to you, Sarah, for organizing. Happy to do an update whenever it is needed. And thank you, everyone, for connecting all over the world.
Just echoing Sarah's thanks to Sarah as well, and to everybody else for the comments, for the useful questions, and for the time.
Thank you.
Great. Thank you, everybody. And I wish you a good rest of the day. Take care.